emergency procedure. So just think of each body system as a part that you need information. So what is head gonna tell us? Neuro. What else? Hearing, so there's senses, right? So we always ask, can you see me, hear me, speak to me? So glasses, dentures, hearing aid, clearly he has glasses, so I would omit that part. So, okay, what else? What else about brain? What else does it tell us? How you doing today, Joe?
Cognition.
Yeah, cognition. What else?
Speech.
Speech, right. He's going to respond to me, clear, tells me if he's kind of with it. Go away. Mood, affect, exactly. So is he responding appropriately? So all of that whole psych. So you think, neuro thinks psych, you remember part of that brain? Your cerebrum, so psych and as well as their thought process, senses, speech, all that. So we ask those questions. Tell me about your night, your plans with some sort of reference to hospital. Your plans at the hospital, what do your nurses have planned, therapists have planned, your plans. And then the last one, what can I do for you today? Okay, in your conversation, that kind of gives you him some leverage to speak, and you get clarity as well as their thought. So think neuro, okay? Neck, if he has anything that's going on, notice it. So I notice, and tell me about the two best things you can do. I notice you have a trach, tell me about it. I notice you have a patch, what is that about, right? Let's get him to talk. I notice you have a mole, is that a change? So we notice and we ask, okay? Then neck, so we no longer have to listen to the neck for bruise, so that's a ease. When you get into your advanced skills, you'll learn about that. Okay, so then we're done with that. Then we go to chest, same thing. So what does chest tell us? Want to put your gown down? Respiration, what else? Heart. And then what is we got going on here? His skin and anything that's attached to him, right? So we notice, I notice you have an incision, I notice you have some sort of lines here, and I notice you have a trach. You don't know how to do trach yet, but tell me about this. What's going on, okay? You don't have to do anything in your head to toe unless they're actively bleeding or something like that. But you could say, so if that dressing is coming off, I'll get to that when I'm done. So I'll change it when I'm done. I notice you have a dressing. What's that about? If they have any tubes or anything, notice that. So you're following your patient down and making sure everything is okay. Okay? So we do neuro, then we do chest, so we listen, we notice. In this place, you don't have to palpate, so you're just gonna listen. So you can, if you're gonna listen to lungs first, you start at the back, lateral, front. If you're gonna listen to heart first, you can start here, then go. Okay. If they can, have them sit up through the whole thing. If not, if they're tired, then back, but try to have them sit up at least. If you have a patient that looks like he's got a lot going on, you could just sneak your stethoscope back here. It's possible, and still hear those basses if he possibly can't sit up. Okay, so in your core assessments, you think of your core, you just want to really use your stethoscope once. So I'm going to listen to heart, lungs, and then I'm going to sneak it down and listen to abdomen. We're done with our stethoscope. And then we'll go to arms and then legs. Okay. The reason we do that is if you are doing your assessment and your patient's going to leave in 5 minutes or something, you have your core. As they're leaving, you can touch, see a Joe, now I have a good temperature, I've got his sensation, I can feel, I can tell if he's got any wounds. If I start with the exterior, arms and legs, and then he has to go, I don't really have a good baseline for much of anything. Okay. So that's kind of how we'll go. The first few minutes you're going to want to spend with the greeting, who am I, why am I in your room, and washing your hands. You don't want to touch your patient until you wash your hands. And then, now my hands are dry, Joe, I'd like to get your name and date of birth. So you take your MAR, and I'm looking for your name band, I see it here, okay? And you compare it directly, name, date of birth, he says it, I repeat it, and medical record number if it's there. Everything checks out, allergies. I always forget allergies, so today I'm gonna remember it, allergies. So we think of armband, allergies. Okay, great, and then we say exactly what we're gonna say. What does this entail? So I'm gonna do what is called an assessment. I'm listening to your heart and lungs, your abdomen, and then I'm just gonna touch your skin and pull back your covers and look at your feet, ask you a few questions, and at the end I'm gonna turn you over and just check out your skin in the back. Is that okay for you? So we tell them what we're gonna do, we explain, we get permission. Is that all right? How long is this gonna take? About 10 minutes. Okay, you good with that? Wonderful, so then I'll start. Another thing to do, maybe even before you start, is see what is attached. So I noticed this big tower of IVs. However, they're not attached to him. So that's a good thing. So I would check my orders. Is he supposed to have an IV or not? He doesn't have oxygen, and I would check my orders. So you have the orders in front of you. I would also look around. I did notice he had that tube when I pulled his shirt down. I noticed that he has some drains hanging. So then again, I would check, make sure at least they're working. Even if I didn't know anything about it, I could report to the nurse. It's on, it's functioning, it's attached. So I would kind of have a look, and you can either do this again at the beginning or at the end. So Joe, I'm just gonna check, and then we trace it back up. Everything connected, are you doing okay with that? He does have his IV line in here. Again, you don't know about IVs yet, but you can see if it seems okay, the dressing's intact, it's not leaking, okay? And he's not attached to anything, it's just a port right now. So currently, he doesn't have anything except for that drain. I don't see a Foley bag unless it's in the bed. So again, you're just noticing. Okay. So that's kind of what you're gonna see me do in the head to toe. So that's kind of the clue. So if you come in and suddenly you think, oh, I forgot everything I'm supposed to do, I forgot this big list, just look at your patient. Their body tells you. So I'm gonna speak to him and check out his neural and his mood and affect, get some information, and then my chest, what does that tell me? Abdomen and legs, okay? And then back. So we'll kind of start from the beginning, but that's how it's gonna go. I might get that general survey, that overall impression when I come in the room. Does it look like he's sort of had a restless night, or does he appear comfortable? Okay, so that's just kind of your observation. Okay, so I'll start. Should take 15 minutes or less, so I'll kind of go through it. You'll notice that, you did these really extensive assessments of cardiovascular and respiratory. Now it's going to be a lot less because I understand you've already been checked off, you know what that involves. So basically respiratory, I'm just saying, noticing, listening. Heart, basically just listening. Arms and legs, abdomen, I'm just listening and palpating. I don't have to identify organs or do any special techniques. And then just asking lots of questions. So you'll sort of see that it's a bit abbreviated. Okay,